colleague from Davao and Isabela, no other than Senator Raffy Tulfo.
Thank you, Mr.
Senator
President.
Raffy Tulfo is recognized.
Thank you, Mr. President. Mr. President, if it's okay, and with the permission, if she will allow, from the good senator from Taguig and Pateros, that I would request for a suspension of rules so that I can direct my questions to the FDA director directly.
Mr. President, apparently the FDA director is not present today.
Or to the DOH secretary.
The DOH secretary is here. Mr. President, I would prefer if I could try to answer the questions of His Honor, and if I cannot answer, then I will pass it on to the DOH secretary. But I
Thank
would
you.
like to make my best effort to answer His Honor's questions.
Thank you, Madam Sponsor. Thank you, Mr. President. Now, if you will allow me, Mr. President, to show a video and some slides. This video comes from the previous hearing where I asked, ayun po, the FDA Director General, after na sila, can we listen to the video first? Budget hearing, titingnan ko ulit yung mga advisory ninyo. At kapag wala, sira. Nag-ikot po kami sa mga tindahan, Binondo, Shopee, and all. Lahat po nang nilagay nyo sa inyong advisory na huwag bilhin dahil mapanganib, etc., etc., andun po binibenta. Wala man nang check sa inyo. Pagdating po ng budget hearing, titingnan po ulit yung mga advisory ninyo. At kapag wala pa rin kayong action, ano pong pwede kong gawin sa inyo, sir? Deal tayo. Ano magandang gawin? So I will challenge you to resign. Tama?
We will comply po, Your Honor.
Thank you, Mr. President. Now, at that time, I called the attention of the Director General because of the advisory that was sent out by the FDA pertaining to some products that they said that should not be, na hindi dapat bilhin ng mga consumer na dahil mapanganib at dahil hindi FDA approved. And I even challenged the FDA Director General na kapag hindi niya pa rin mapaalis sa merkado yung mga produkto na sinasabi nila sa FDA na banned, ay siya'y mag-resign. Sabi niya, he will comply. And I still have the list of the same products na binibenta pa rin po sa Shopee at Lazada, yung mga products na sinasabi ng FDA, Mr. President, na warning, huwag tangkilikin ang produktong ito dahil mapanganib sa kalusugan sapagkat hindi sila FDA registered and approved. So since the last hearing, up to now, wala pa rin pong ginawa, Mr. President, ang FDA.
Mr. President, I asked, well, the DOH, the one replying is the FDA deputy, no? The deputy, what's your name?
Franklin Anthony Tabakin.
Tabakin. So Deputy Director Tabakin is responding to His Honor's queries. So they have this takedown step, and it starts with a letter, and they have issued those letters on November 7 to Shopee, Lazada, TikTok, Carousel. And I said, what is the response after these takedown letters were sent? wala pa daw sagot, which is very disappointing because November 7 is almost 20 days, 19 days. I can't believe that these platforms would ignore a government takedown order for 19 days. So, in any case, Mr. President, so I asked the next step, what normally happens when this, I would think you expect a response in 2 days, in 3 days, kasi it's government who's writing to you. And they said, itong mga platforms, they are used to dealing with DTI. So FDA has already informed DTI of this step that they have taken, and they really want to work with DTI because I know from our own experience with itong mga bawal na mga vapes, yung gumagamit ng mga cartoons, bawal yan under our law. DTI immediately issues the takedown, sumusunod. So, apparently, may takot sila sa DTI, pero sa FDA, wala silang takot.
But FDA is coordinating with DTI.
Yes, but yun nga, they are now coordinating with DTI. Pero sayang, kasi we just took up the budget of DTI. Sana natanong natin si DTI kung ano kayang status nito. Or tawagan natin.
Yeah, pwede naman.
Tawagan nyo, kasi may contact na tayo dyan when we complain about those Para I can give His Honor a response because it's very disappointing to hear that it's still up there.
That's right. Thank you for that answer, Madam Sponsor, Mr. President. So that means kung hindi po mag-respond ang Shopee doon sa letter ng FDA, so tuloy-tuloy pa rin po yung pagbebenta ng mga produkto na sinasabi ng FDA ay dangerous sa kalusugan ng mga
Yes.
consumer.
Tuloy-tuloy, Mr. President, that is a correct observation. And not just Shopee, itong Lazada, TikTok, and Carousel. I cannot tolerate it because it is posing a clear and present danger every day that it stays up there. So I'm very disappointed to hear that they're not responding, not even corresponding with FDA on this takedown letter that they sent.
Pero Madam Sponsor, Mr. President, I'm not going to blame Shopee. Ang i-blame ko rito, yung mga taga-FDA. Kung gano'n, hindi pala sumasagot yung Shopee, ba't hindi nila puntahan ang Shopee, hindi nila puntahan ang Lazada? Meron naman silang enforcement power under Section 19. FDA shall establish Regulatory Enforcement Unit o REU. In fact, itong unit na ito allowed sila to bear arms. Pwede silang mang-raid if need be para enforce yung regulatory power nila, yung advice na inisyu nila, at kung sino lumabag doon, they can go in and confiscate those products.
Actually, Mr. President, His Honor has a very good point. However, if you go to the office of Shopee, Lazada, and the rest, wala ang stock na yan doon kasi they are online platforms. So, yung ability ng ating FDA cannot be implemented. In fact, for online seizures, they do not do it this way. They really coordinate with, with DTI also, because DTI is the one that has been working on the takedown of these products on these online platforms, Mr. President.
So therefore, Madam Sponsor, Mr. President, it's up to the FDA to coordinate closely with
DTI.
the DTI
Yes.
na para ma-take down itong mga products na sinasabi nilang bawal. Pero,
Yes.
Mr. President, marami akong mga binanggit during the last hearing. Meron mga na-take down. Pero ang lumilitaw dito sa akin, selective lang yung tinitake down nila. In fact, 2 or 3 were taken down since the last hearing. Ang masama nito, itong mga mas delikado pa ang hindi tinitake down tulad niyang glutathione collagen glow. Meron na pong na-disgrasyang bata dyan na ospital at naging malubak.
Po yung gummies, no?
Ay,
The one you brought up before, yung
gummies.
gummies,
Yes,
is very
sorry.
attractive to children, no?
Gummies. And
Yes.
then another one pa, ito pong Hokkaido Slimming Pills, it contains amphetamine.
Wow.
Amphetamine, ito po yung kasama doon sa shabu na causes regular heartbeat, confusion, urine retention, painful urination, etc., etc. Pinagbabawal po ito. Dapat prescription drug to. Pero over-the-counter, nabibili po ito sa Shopee. Addictive po ito. And Na-mention ko na po ito during the last hearing at sabi ng FDA, yes, iti-take down din nila at kausapin yung Shopee para ma-take down na yung product na yan sa Shopee. Pero hanggang ngayon, every single day, maraming bumibili po nito, Mr. President, at who knows kung ano na nangyari doon sa mga bumibili nito, Mr. President. Ito pong
President.
Hokkaido Slimming Pills.
Itong Hokkaido, can you give me a response kung ito nabigyan na rin ng takedown order? Mr. President, while we're waiting for the response on the status of these Hokkaido pills, I would also like to share that I had wanted to ask, normally what DTI would tell us when we bring up these kind of instances to them, and again, as I said, these are usually in the cases of itong mga bawal na vapes. Pag take down ng isang company, magtatayo lang naman ng bagong company para magbenta on their platform. But you know, Mr. President, now that there is AI, it is so easy. Para nga sa staff natin, isang click lang yun, makikita mo kung sino nagbebenta. With AI, it's so easy to alert the platform that these products that were already deemed not fit for human consumption should immediately be banned from their platform. Hindi na kailangan na mag-antay pa sila ng takedown. Napaka immoral na, no? Hindi lang illegal, immoral na yung ginagawa nila because yun nga, and I don't even think it needs any sophisticated AI. It's so easy to detect what are those products that have already been flagged. They should not be there. So I'm with His Honor on this one. His Honor can rest assured na itong mga products that he has brought to our attention, isasama ko po ito sa kasama ng listahan ko ng mga vapes na ifa-follow up natin ang sunod-sunod para kung kailangan araw-araw ma-remind na wala yan sa mga platform, gagawin po natin yan. But do I have an answer regarding Hokkaido?
We'll check the Hokkaido script kasi it's a long list. Kasi products.
Itong
Unregistered products. Baka isa doon yung... Baka isa doon.
na inano nyo, na pina-take down nyo, or... Okay, sige. So, Mr. President, according to the Deputy Director, they have 850 products that they are monitoring that are unsafe or violate their FDA standards in any way, including registration. So, they're checking now if Hokkaido is included in that list and will give us the status of what they've done about it.
Thank you, Mr. President. Yung hearing po, yung nakita sa video, I think it was conducted on October 1. Pero sabi po kanina ng FDA, Mr. President, November 7 lang nagpadala ng letter sa online. So it took them more than a month to just send a letter to different online platforms.
This is after the hearing, no, Mr. President?
Yeah, the hearing
that
happened
is his honor's reference, right?
October 1.
Yeah, so nag-hearing tayo ng October 1.
And then
Anong ginawa niyo since
after
then?
1 month pa lang pinadala yung sulat. So, napakabagal, Mr. President. And every single day, tinatangkilik na maraming Pilipino ang mga produktong sinasabi ng FDA, huwag tangkilikin dahil yan mapanganib sa inyong kalusugan.
Mr. President, according to the Deputy Director, they had a change in leadership and he just came in October, so it took a while for them to, this is not the only action that they've taken. So they were able to release these takedown orders not as quickly as they normally would, but we have their assurance that in the future, if we call them, of course there is a process to be observed. Pagka ganito ba na just to help the public understand, no, itong Hokkaido slimming pills, as early as 2014, there was already a notice from FDA, notice to the public health warning against the use of banned or unregistered slimming or anti-obesity products sold in outlets or offered online. At kasama dito po si Hokkaido, may picture pa nga siya 2014 pa lang. So that notice is there. So if you would see that the product is available online, wala na kayong gagawin. You just have to verify that this is the same product that you've issued a notice for. Tanggal na kagad, di ba? Within the day.
2014.
2014
So
pa, sir.
more than 10 years na, hanggang ngayon, pa rin
Yeah,
na
yung
take
pinakita
down.
yung product pink, no?
Wow.
Yung pink. Pakita natin kay, we can ask the page to show Senator Tulfo itong picture to be sure it's the same.
11 years.
It looks the same.
Ah,
Oo. So, as I said, Mr. President, madali sa kanila yung physical stores. Doon daw, nakakuha sila, naka-raid na sila dyan. Pero yung online, yan yung medyo problema kasi pasulput-sulput yung, ayan, it's the same, Mr. President.
we have the actual product, Mr. President. Hindi, pura ito.
Hindi pwedeng answer yun. They have a responsibility.
Saan nakalagay yung kaido?
No, pero sa
Saan ba yung kaido? Ito yung gamit, yung Hokkaido. Ba't ko nang tatapos ito?
Wala ko sa table ko. Pero may flash sa kanila.
Oh, that's the Hokkaido, Mr. President, I'm talking about. So that's the same product na sabi ng FDA kanina na 11 years na nila at pinagbabawal yan. 11 years na nasa advisory nila, warning na huwag tangkilikin. Up to now, after 11 years, hindi pa rin natitake down at pinapabayaan lang po ng FDA na tuloy lang ang pagbebenta nito sa merkado, Mr. President. So, for me, tama lang talaga yung sabi ng ARTA na ang the most complaint agency in the Philippines is FDA. And for me, one of the most corrupt agency in the Philippines is FDA, and I'll tell you why later, Mr. President. Ayan po, nangunguna sa most complaint agencies according to ARTA. FDA number 1, LTO number 2. And a good example, Mr. President,
Yeah.
Ito,
Just to add to
yes
the
po.
discussion, Mr. President, because I was chairman of the Committee on Health for 9 years, from 2004 to 2013. And at that point, we had asked on behalf of DOH and FDA that they would be able to retain their funds, especially after we passed their new law, no, creating the FDA, kasi dati BFAD yan eh. And they are allowed actually, Mr. President, but they must present a 5-year development plan. So when I inquired during the hearing for this year's budget, itong 5-year development plan, kasi nga may new leadership this year, they are in the process of finalizing that, and that would allow them access to more funds to be able to implement their mandate more efficiently, Mr. President. So I believe that they have recognized their shortcomings in terms of all these backlogs, their delayed responses, and they're assuring us, Mr. President, that they are addressing this and that the submission of this development plan will also help them improve their services, Mr. President.
thank you for that answer, Madam Sponsor. So, ano po yung game plan ng FDA para once and for all magawa nila yung trabaho nila, yung mandato nila para yung sinabi nilang huwag tangkilikin because they issued an advisory ay maisakatuparan nila nang sa gayon magiging safe na ang public from consuming products that are not fit for human consumption, Mr. President.
So they are now in the process of working with DTI, and they will execute a MOA so that they can work more efficiently with DTI, because as was mentioned, it's DTI that coordinates with these platforms. I think they have a lot of dealings with these platforms. So maybe yung relationship nila mas efficiently nagkakaroon ng sagot. Kasi nga, the fact na almost 20 days has passed and these platforms did not even think of responding, I think that poses a big problem. Can you open it again? And they also have, Mr. President, would His Honor like to hear it, yung response nila regarding their being at the top of the list of most complaints with ARTA. Would His Honor want to hear what they intend to do about that?
Yes. Yes.
So
Madam.
basically, they have been coordinating with ARTA to help them have a more focused approach to these complaints, and they've created a frontline service through FDA Action Center where complaints can be received, increasing also their manpower by completely filling up the plantilla positions that will help improve their output. Expanding manpower by securing NOSCA. What's NOSCA? The items, specific items, for additional 125 personnel. Increase the speed of the online service with zero downtime. I'd just like to put on record, for the past 2 decades, me and my brothers have businesses that sometimes require FDA clearance, at yung kapatid ko naiiyak na dahil pag weekend off yung online, Mr. President. Off yung website. Sabi niya, ate, paano saan ka nakakita ng online na off? Online na nga yan, off pa. You cannot even, so if you're working, and a lot of entrepreneurs work 24/7, you will send some requirements online, off siya pag hindi office hours. Ang sinagot sa amin doon, they are under maintenance. Pero sabi nung kapatid ko, ilang buwan ng under maintenance kasi ilang buwan ng hindi accessible yon pag hindi 9 to 5. So, nakakaiyak naman talaga, just to share na I have information also on this. Ano pang idadagdag ko doon? According to them, Mr. President, dun sa 599 complaints, 570 have already been acted upon and are now marked as closed in the ARTA database. The remaining 29 are still undergoing assessment and review for proper classification if within ARTA's jurisdiction or not. So sige, but kahit naman outside of ARTA's jurisdiction, my comment lang naman is, as a government office, you still have to respond to that and still have to resolve the issue on hand, di ba? It may not be covered by the specific days, no, that ARTA requires, but it still has to be resolved.
Thank you, Madam Sponsor, Mr. President. Gusto ko po hain ng challenge sa FDA for the second time kasi noong October 1st, nagbigay ako ng challenge sa FDA, and this is the second challenge I'll give FDA. What if my office or Raffy Tulfo in action, mapatake down yan in 1 week or less, yung mga product na sinasabi ng FDA ay huwag tangkilikin, pero ang sabi ng FDA, mahirap nilang patanggalin. Paano kung kaya kong pantanggalin yan in less than a week? Would the FDA director willing to resign? Or Director General?
Well, wala po dito si Director General.
How about if I'll tell the Secretary? Will you tell your Director General of the FDA, kung pa-take down ko mga yon na pinakita ko in 1 week, will you ask him to resign? Challenge taken.
Secretary said
Kasi
yes.
lumilitaw na inutil po yung Director General. Kaya nga po paulit-ulit napapalitan po yung mga Director General ng FDA. In fact, I was one of the reason many years ago na napatanggal ko ang isang FDA director dahil for this same problem, Mr. President, because of the corruption, rampant corruption dyan po sa nangyari sa FDA. Mr. President, so with the Secretary would agree with me na kapag napatake down ko po yan, na sila hindi na kayang patake down for 11 years, kung mapatake down ko yan in 1 week, can the Secretary ask the FDA Director General to resign? dahil inutil siya.
Sumagot na po ng yes si Secretary, Mr.
Thank you.
President.
Thank you very much. Thank you. Sobrang thank you. Okay. Now,
May question po ako, kasama po yung holiday. Kasi November 30. Mabuti ng maayos kasi baka ako mag-mediator
okay,
dito.
less holiday. Less po ng holiday. Wala, working days lang.
Okay. Sige.
Working
Pasay
days
Day. Kasi tayo holiday, Pasay Day, sila hindi. Nagpapatawa lang po ako.
Thank you, Mr. President. Basta't working days na lang. Kasi yung Shopee hindi naman sa Pasay, Mr. President.
Tsaka yung FDA nasa Alabang.
Nasa Alabang po, Mr. President. Okay, thank you, Madam Sponsor. Thank you, Mr. President, for that. I have a few more questions. Magkano po yung budget ng FDA, Mr. President?
So the total appropriation, Mr. President, is 1.137 billion.
Okay. Thank you, Madam Sponsor. Pwede hong makakuha ng breakdown kasi ang pagkakaintindi ko, 600-something million budget from the government and then 500 million yung galing sa revenue nakita nila. So that will be 1.1-something billion altogether.
That is correct, Mr. President. So there's a new appropriation of 620,626,000, and then automatic appropriation is 517,032,000 pesos, Mr. President. So the total is 1.1. Excuse me, 1.137 billion, Mr. President.
Thank you, Madam Sponsor, Mr. President. Dalawa lang issue sa FDA, Mr. President. Gaano po katagal ang processing ng CPR or Certificate of Product Registration? Meron ho ba tayong standard na sinusunod as to the length of the processing period? Kasi ayon sa ARTA, it should be 20 days, it could be 30 days, or a little more.
So yung CPR-PSC, depende siya kung cosmetic.
The reason why I asked that, Mr. President, dahil marami pong mga nagsusumbong na sa akin na yung kanilang mga CPR umaabot na 3 taon, 5 taon hanggang sa they just give up dahil hindi napoprocess yung kanilang CPR. Pero kapag yung mga multinational pharmaceutical companies nag-apply, in less than a month, naaprubahan, Mr. President.
Hindi, asan yung regulated? Yung mga medicines, drugs.
Under the base ng Fed.
At kapag naglagay yung mga maliliit na pharmaceutical company by the millions of pesos, saka sila naaprubahan, Mr. President.
Mr. President, I can give you the number of days that they are, well, it says here average processing time, so I don't know if this is accurate, no? But I'll just read it and then I will
Yes,
ask
thank you.
FDA to confirm, because what His Honor says is also information that I have received na buti pa kamo kung umaabot lang ng buwan, di ba? Umaabot talaga ng taon. So, but, okay, the official answer is for cosmetics, the CPR working days is 17. For toys and childcare articles, it's 12. For household urban pesticide, pag initial, it is 86 days. So that is almost 3 months. Pag renewal, mas mabilis. I guess kasi very, very, it's a hazardous product, no? Kasi pesticides. And then household urban hazardous substances, 85 days din ang initial. So that's around 3 months. And then for those that fall under the Center for Drug Regulation and Research, mga gamot natin, no? It is, for initial, it is 463 working days. So that would really be around 2 years. Well, that's the answer, around 2 years.
That includes the over-the-counter
Is there a difference?
drugs?
It's still a drug, but by practice, is it faster? Yung mga over-the-counter?
It's new daw. Pagkas new daw.
So, anytime that it's a new product, Mr. President, regardless if it is over-the-counter or a prescription drug, it takes this time. I'd just like to add something to the discussion because I also want to hear the answer, and it will maybe help us understand, not necessarily accept the time it takes, but to understand. A few years ago, after we passed the FDA law, it was explained to me that the process that is being followed is it's actually a review of documents. So, for example, a product is registered, let's say, in a regulatory agency that is first class. I don't know what you call them. First, like a mature. There you go. A mature regulatory agency. Then you go through the papers that have been submitted. So when that was explained to me, I was quite excited because I said to myself, and this is like a decade ago, Mr. President, I said to myself, oh, then that would really expedite the process. Kasi nga, it's a paper review. As long as yung papers na hawak mo are genuine, I think meron pang submission niya na kailangan i-prove mo na itong papers mo are properly documented, it would take less time. And yet, here we are, 463 working days pa rin. So, I do not know why it would take that long when it's really a paper submission and these are products. I think it's quite rare, Mr. President, that the products are being registered in the Philippines for the very first time. They either would have been registered in the US, maybe in other Asian countries. Ang problem daw nila is lack of manpower, and the answer there is they cannot hire more if you do not submit your 5-year development plan, which narinig ko na a decade ago.
Correct.
Tumanda na ako ng 10 decades, ng 1 decade, naririnig ko pa rin yon.
Correct.
Sana hindi rin
Madam
kayo magpaabot ng 1 decade bago natin mahanap yung solusyon na ito.
Tama kay Madam Sponsor. Nag-promise ang FDA, that was back in May, sinulat yan sa Philippine Inquirer and then Manila Bulletin and ABS-CBN, na nag-promise ang FDA that to cut by half approval time for new products.
When is that? I just can't see the date. Is that this year?
That was May 5, 2025.
When the new director took over, Mr.
Yes.
President, yan yun.
He promised it, pero Mr. President, marami pa rin mga complaints na kadating sa akin na 5 years hindi pa rin po naaprubahan yung over-the-counter nila ng mga application for CPR, over-the-counter medicine for CPR. And also, Mr. President, napansin din ng mga na-complain sa akin, pag mga multinational companies ang nag-a-apply, napakabilis ang approval ng CPR, Mr. President. Pero pag malilit na pharmaceutical companies, ang tagal, ang bagal, at kailangan magbraswan pa. And if necessary, kailangan magkaroon pa ng lagayan, Mr. President. In fact, I'll tell you a story, Mr. President, Madam Sponsor. Merong isang FDA, mataas na official, kinailangan mabigyan pa ng 20 babae at 10 milyong piso bago makaprubahan yung isang produkto. At ang masaklap pa niyan, nabigyan na nga, hindi pa rin nag-deliver doon sa promise na aprubahan po yung produktong napipending ng FDA, Mr. President. And another example, Mr. President, Madam Sponsor, in 2015, merong isang insect killer registered sa FDA. Makabago siya kasi water-based. He entered into the market 2015. It went smoothly. And then, pagdating ng 2021, this product was making 100 million pesos. All of a sudden, hindi na ni-renew ang kanilang CPR. Pumasok ang Baygon, ginaya ng Baygon yung ingredients nila which is water-based, and now Baygon has it. Pinatay nila itong strike insect killer para pagbigyan na wag bumaba ang sales ng Baygon dahil kinakain na ng strike ang kita ng Baygon. Mr. President, marami pong ganitong senaryo na pinapatay ang mga produkto na gawa ng mga maliliit na pharmaceutical companies just because sila po ay nakakapitas ng revenue sa mga malalaking products na multinational companies because they're cheaper. And this is a good example, this strike insect killer. And it happens on a regular basis, Mr. President. Pag yung malalaking pharmaceutical companies na apply ng CPR, mabilis ang approval, boom. Pero pag yung maliliit, napakatagal. At there are times na naaprubahan at magandang takbo ng produktong yon, nakita ng mga multinational companies, mukhang tinatalo na kami nito, mas mura pa sa amin, pinapatay po ng FDA. Yun po sinasabi kong korupsyon. And that happens on a regular basis, Mr. President. I think it's about time na talagang magkaroon po ng house cleaning sa FDA, Mr. President.
Mr. President, I'm very bothered by what His Honor says, but I believe that mukhang totoo yung mga yan kasi nangyayari po yan worldwide. It's not acceptable, but well-documented kasi yung mga ganyang kwento in the books that I read, no? So that's why I'm not surprised at all. Yun lang, walang nagpa-publish ng librong ganyan dito sa atin. Baka kayo po pwede mag-publish kasi ganyan-ganyan din yung mga kwento,
Thank
Mr.
you.
President. That's why I believe you. Baka in our own little way, what we can do together is pag may narinig kayong report na gano'n, I would be happy to assist and tawagan natin, monitor natin, di ba? Para kung not kung, kasi mukha talagang may gumagawa ng kalokohan, kung kaya natin ma-prevent na mangyari yun dahil natitrace natin na o ganitong araw binigay, di pa rin lumalabas, o ganitong araw hinarang, ano yung basis, I would be it would be an honor, Mr. President, for me to help follow up on these cases. Kasi I'm also an entrepreneur and I feel so bad that these hardworking owners of these small companies nagagamit pa ang gobyerno para yung kanilang maayos na negosyo sirain at ang iba ang nakikinabang. Hindi ho tama yan. And now that you've told me about it, I would like to be part of the solution, Mr. President.
Thank you, Madam Sponsor. Thank you, Mr. President. Now let's move on sa DOH. In the past 3 years, millions and billions of pesos worth of medicines na expired or hindi na-deliver, which cost that much sa ating gobyerno. Bakit po tuloy-tuloy pa rin yun sa DOH, itong mga medicines na napapabayaan mag-expire o hindi na-deliver? Magkano yung amount?
Ito po, until the next page.
Hindi, saan yung mga amount?
Yung per year amount po siya sa
Ito?
Opo, sir. Wasted amounts.
2018 was 18.5 million, 2019 2.2 billion, 2020 95 billion, 2021 85 million, 2022 7.4 billion, 2023 11 billion. So these are medicines that expired or nearly expired drugs and medicines.
Okay, Mr. President, the response of DOH is their logistics. They have problems with their logistics, and that's why they are continually working on improving the supply chain and also asset management, because in the past, according to the Secretary, dinatnan na rin nila itong mga gamot na nag-expire. And the practice is they will order at a certain point, nire-repeat lang nila yung order. So they need to improve their asset management so that they can order more efficiently. But ako na rin magdadagdag ng problem natin kasi ang problem naman, and I don't know if this is a separate issue, Mr. Secretary, na meron namang gamot na kinukulang na hindi nakakarating. Di ba? I think in the last, kasi this is a part 2 already of our budget defense, may nagtanong na rin kung bakit yung mga, I think it's a Senate President on the vaccines, no, that were not available.
Yeah.
So either nauubos or hindi available. So really I have to improve on the management of these products kasi we don't want it to happen either way. I know, and I've always defended the budget of DOH, na there's a certain minimum percentage that they are allowed to have in excess. Kasi nga, you have to have that available para nabibigay nyo in a timely manner dun sa mga lugar na nangangailangan. So for example, in times of calamity, di ba yung leptospirosis, umaakyat. So you want to have that readily available as stockpile. Pero hindi nga pwedeng sobra-sobra na naiipit dun yung pera ng pera ng tao dun sa gamot na yon. Hindi naman pwedeng kulang na wala naman tayong ma-deliver. So as the secretary said, it's asset management.
Ngayon, hindi pa rin natatandaan sa supplier kapag malapit na siya mag-expire 6 months. Pero
Oo. Meron din practice, Mr. President, na na-report ko na kasi pang-6 na taon ko na itong dinidefend ang budget ng DOH. Meron silang guarantee letter with the suppliers to replace the products if 6 months na lang ang shelf life. So that would ensure that ito yung mga LGU, yung mga ospital, that they have fresh supplies. May ganun ding practice, Mr. President, based on an AO issued in 2019.
Sir President, with the permission of Senator Tulfo, may I, Madam Chair, may I just interject just one statement or one question?
Ngayon lang.
Okay lang, sir. Yeah.
With the permission of the chairperson, Senator Alan Cayetano is recognized.
Permission granted.
Madam Chair, you said either kulang or what, yung vaccine?
So no, I was saying that the issue raised by Senator Tulfo is on expired medicines na hindi nagagamit. So sayang, 'di ba? Sayang ang pera ng tao. Tapos sabi ko, in the previous budget defense just last week, meron namang si Senate President asked naman about yung supplies naman na kulang. So I was saying that it's two issues on the different side of the coin, di ba? Yung on the one hand, may gamot na kulang, nauubusan, hindi ma-deliver sa tao. On the other hand, there are other medicines na sobra-sobra at nasasayang ang
And that is
pera.
the answer of the DOH.
It's not my answer, it's the answer of DOH.
So let me just say, for the record, it's completely wrong, and they are, I'm not allowed to say bini-BS tayo, no? Because you talk to all the mayors, and I'm married to a mayor, they're either late, kulang, or malapit na mag-expire. All around the world, ang flu vaccine, lalo sa matatanda, ay binibigay ng March at April. Even assuming na naganggaling pa sa Western countries yung flu vaccines ng March or April, sabihin mo nang dumating dito ng August or July, ngayon po, November 26, wala pa ho silang vaccine for flu. And it expires on December 31. Yung mga matatanda na iba, ayaw na nila ng flu vaccine ng November late. Ngayon, late na late. Secondly, doon sa routine vaccine that you fought for, Madam Chair, that you fought for, ever since Secretary Herbosa took over, it's late or kulang. Wala talaga, hindi dumadating. Wag nila sabihin may sobra and ibang issue yon. And etong problema, Senator Tulfo, thank you for this time. Yung parents, ayaw nang pabukunahan yung ibang anak kasi nagdi-deliver sila 1 month na lang, expired na eh. Paano nangyari yon? Pumunta ka sa private doctor, 2, 3, 4 years yung expiration ng ibang vaccines. I'm not talking about the flu, I'm talking about the routine. So in my time, I don't want to take the time of Senator Risa and Senator Tulfo. We'll go into that, Madam Chair. Pero, you know, sabihin na nila kung anong problema, kung bakit, 2 years na eh. 2 years na, parating late. If you want, patuloy natin to tomorrow, let's randomly call 10 mayors and 10 governors. They'll tell you all the same thing. The DOH is not delivering enough. Tapos pag nag-deliver, late. Tapos pag nag-deliver, ready to expire na ito. Can you imagine last year? Maraming hindi na bakunahan, tapos na yung pandemic. Nung pandemic nga, gumawa ng paraan eh. Na kahit na naka-lockdown, nagkakagulo yung mga health, yung mga experts natin kung paanong ituloy yung bakuna. Pero last year, nandyan lahat ng pera, lahat ng bakuna nandyan, hindi nila ma-deliver. Panay excuses eh. Madam Chair, last point. Hindi pwedeng bumili ang LGU eh. So wala silang choice. Ibigay na lang ng DOH yung pera sa LGU, sila bibili. Maraming vaccine nung yung routine sa mga bata, hindi pwede. So, Mr. Chair, sorry, Senator Tulfo, alam mo naman, respeto ko sa iyo at never ako nag-i-interrupt. Pero
That's okay.
yung ganong klaseng sagot ng DOH, huwag tayo magbuluhan dito. Health ng mga bata to eh, future ng bansa to, tapos ganyan ang sagot natin na meron ganito, merong. Hindi totoo yun. 2 years na. Kailan magbabago yan? Can you guarantee us? O yun, isang tanong lang. Can you guarantee us in 2026 there'll be no delays? Because if not, let's get a secretary who can. Cambodia at saka Laos hindi nalilate yung bakuna Pilipinas nalilate yung bakuna. Sorry for that, Mr. President.
Yes, we took that up the last time around, if the chairperson will recall. The LGUs may, but ang presyo, times 10. Kung 10 pesos ang bili ng DOH, pag LGU ang bumili,
Mr. President,
nagiging 150 pesos or 100
Mr.
pesos.
President, hindi lahat po I just called yung city health namin. There are certain vaccines they're not allowed to buy kasi DOH lang ang pwede.
Yeah, anyway, doon man sa pwede, mas mahal kaya hindi sila pwede.
Okay, can I give a quick response, no?
Mr. President.
So, Mr. President, the Secretary admits that they've had a major procurement problem. In fact, he has fired their procurement officer. As to whether they can handle it better next year, I don't know yet if there's an answer because the Secretary admits that given the billions of pesos involved here, there is so much competition among the bidders, and this representation recognizes that that is an issue, but that this representation also recognizes that if there's a will, there's a way, because if Cambodia and Laos, if we do our job well, hindi dapat
Madam Chair, just as a follow-up.
let me complete my sentence. These bidders should be the ones following our rules and not dictating. Because of the delay, then we are now putting, I am one with His Honor that we are putting our children's lives at risk.
Yes. Sorry to interrupt, Madam Chair, but you're talking about bidders. Hindi ba ang ginawa ng DOH dinaan sa UNICEF? Di ba ang procurement nyo ng vaccines ng routine dinaan nyo sa UNICEF?
According to the Secretary, before it was, and this representation also remembers, before, like for example, the hepatitis B vaccine was passed through UNICEF. Pero now, according to the Secretary, mga 10 years ago pa daw, that, according to the Secretary, nung USEC pa siya, sandali, I am receiving conflicting information. Hold on. Hold on.
Di ba? Dinaan nila sa UNICEF. Yan yung pinail sa Ombudsman, no? A release of 1.2 billion to UNICEF from February to July 2024. Ano yung matagal na at dati? At coincidence lang ba kasi tumatakbo yung secretary sa WHO?
That's why I said, give me a minute to get a clear response. So, due to the measles outbreak, there was a purchase. Is it a one-time purchase? There was a one-time purchase through UNICEF because of the measles outbreak. But aside from that, they do not purchase from UNICEF. So, His Honor is correct.
So,
there was a purchase.
Yeah, so the point is kasi, hindi dapat magkaroon ng problema sa bidders eh. 'Di ba? Ang passport, 3 years nagka-problema sa Aquino administration. 1.5 years 1 year nagka-problema before my time sa DFA. Noong time ko 9 months kaming ginugulpe. Then we solved it. O sa LTO, 3 administrasyon, umupo si Vince Dizon. In 3 months na solve niya. Plaka ng kotse. Di ba, Senator JV, Senator SP, I think, di ba, nung term mo rin yun nung Daming problema sa LTO di ba? Yung plaka tsaka yung even lisensya. Na-solve lahat Di ba? So, I mean, eto, immunization sa mga bata, you don't know how to slap people around. May mga siraulong bidder dyan, naloloko-lokohin yung bidder, di pakulong nyo. You cannot, sorry Senator Tulfo, usually ako malamig uno, ikaw mainit ulo, pero you cannot guarantee, I'm not talking to you, my dear ate, I'm talking to the DOH family and the secretary.
Natin si Senator Tulfo sa podium.
If the secretary cannot guarantee us that in next year there'll be no delays, of course, yung delays that are not foreseen, di ba? Kung may bagyo or nagsara ang mga port at hindi ma-deliver. But yung delays that happened the last 2 years, he has no business being secretary. Imagine, Mr. President, nandito tayo ngayon, 7 p.m., nakikinig tayo, nakailan beses na ang DOH. Hindi nyo magagaranti na bakuna lang, hindi on time. 30% of our kids are endangered of stunting. Ilan sa kanilang endangered dahil nga sa kahirapan dito sa mga sakit na i-prevent ng bakuna. Ang dami natin pinag-uusapan dito, budget nyo, laki-laki, tapos yung on time lang yung bakuna. O ibigay nyo lang sa Senate yung pera, kami na magbibid. Kami na magdi-deliver. Sorry, Senator Tulfo, but thank you for this intervention. But I think it's unacceptable that we do not have a hard answer here that hindi madidelay ang mga bakuna. We're not talking about all kinds of medicines and competing. Ang pinag-uusapan pa lang natin yung routine na bakuna plus sa senior citizen na yung flu. Yung flu lang, hindi natin ma-solve yun. To be fair, past administration, November din. Kung yun ay ginawa ni Secretary, at least may isa siya na hindi nagawa ng ibang administrasyon. Pero wala Imbis na November 1, nandito na. November 26 na, wala pa rin. Kasi tayo, komportable tayo. Nagkasakit tayo, may St. Luke's, may Asian, may Makati Med. Pero paano naman yung mga kababayan natin na may nanay na 80 years old na napakahirap? Pagka nag-flu, tapos nagka-pneumonia, mamamatay na lang. Di natin bibigyan ng bakuna? It's just unacceptable, Mr. President.
We understand the frustration, Mr. President. Just to put on record, because the Senate President asked a very similar, identical question about the vaccines, no? The response that we got from DOH is precisely because of the procurement problems, and this is referring to the flu vaccine. The procurement problems, the problems with the bidders, the vaccine, which was due to come sometime March, April, kung madelay man sana May, will be arriving December. So what they did was the December vaccine is now has that formulation for the next year's variants of viruses that are normally, that are predicted to happen next year. But I hope Senator Alan heard that because that response was for him. Thank you, Mr. President. Senator Tulfo, you have the floor again.
Thank you, Madam Sponsor. Thank you, Mr. President. Sabi po ng DOH kanina, logistic ang problema, kaya nagkakaroon po ng worth millions and billions ng mga medicine na expire and about to expire. Ginamit po yung reason na logistic problem. Ano po yung proposed solution ng DOH tungkol dito? Madam Sponsor, Mr. President.
So the solution there, Mr. President, is to improve this asset management and supply chain, and the Secretary created a committee that will be handling that so that they can make timely orders for the products that need to be replenished and would not be ordering for those items that still have stock, Mr. President.
Thank you, Madam Sponsor, Mr. President. Baka hindi naman po yung logistic problem ang problema talaga. Baka ito yung incapable small-time fly-by-night na mga nanalo ng mga supply contract, Mr. President. Nabanggit nga kanina, Senator Cayetano, Senator Alan Cayetano, na late na dumarating yung mga medisina. And it's been happening for so many years, Mr. President, time and time again, year after year. Ba't di natin mapatigil-tigil na yan? Bakit hindi tayo naghanap ng sistema ng once and for all? Mabing na po yung solusyon na yun na sinasabing logistic problem at kaya nag-expire ang mga medicines worth by the billions.
So, Mr. President, according to the Secretary, he intends to go into a framework contract similar to how DSWD handles their food packs, wherein it's a bulk order, but it is delivered to them upon need. So that is the solution that the Secretary is planning to initiate, Mr. President.
Thank you, Mr. President. Now, ano-ano po, Mr. President, yung mga gamot na nag-expire or about to expire na every year na lang nangyari by the billions of pesos, what are those medicines, Mr. President? What kind of medicines are they?
Madami, we can submit na lang.
Tell me how many pages. Mr. President, I have a list. I can give His Honor a copy kasi it's about 4 pages. Would His Honor like me to read a few or just give you a copy?
Just a few sample.
Sige.
I would like to hear like yung mga maintenance, multivitamins, like Lazartan, like metformin, things like that. Yun po yung gusto ko marinig sa listahan. Nandiyan po ba yun, Mr. President?
Wala sa list.
Saan ano natin? Yung mga response.
Ayan po, flash na.
So, for example, Mr. President, for Losartan, 50 milligrams treatment pack. So, it's a treatment pack. And the number here is 150. I'm asking for the unit, if this is box. Also, how many is in a box?
This one is near expiry.
And then these are near expiry. So, this is not a list of expired, but near expiry.
Near expiry. So these medicines nakarating po doon sa mga taong dapat makinabang noon,
Asan
Mr.
to
President?
ngayon? We will ask that, Mr. President. Itong 150 boxes, where is this? In the warehouse? In the hospitals? It's in the warehouse. Okay. These are still in the central warehouse. And then I'll give another example, mefenamic acid, 250 milligram capsule, 3,000, is this boxes? Boxes. Also in the warehouse. Near expiry, Mr. President.
So as we speak, yung mga binanggit niyo po mga medicines, nandun po sa warehouse, nakatenga lang, mag-expire na, Mr. President, and they're worth billions. The reason why I asked that, Mr. President, tama kayo, dahil yan po precisely ang sinasabi ng mga health workers sa mga barangay na wala raw sila. Yung pala yun. Yung kailangan ng mga gamot ng mga barangay health centers, nandun lang pala sa DOH bodega na pinapa-expire. Mr. President.
So, Mr. President, to let His Honor know what is going on here in the back end, pinapaliwanag po nila sa akin na ito po ay mga emergency medicines na naka-standby. Pinapaliwanag ko din sa kanila na kaya nga kayo nagtatanong dahil yung mga barangay health workers naka-standby din at nag-aantay ng
Thank you.
delivery.
Thank you,
so,
Madam President.
I am trying to get
Madam
an
Sponsor.
answer kung bakit hindi nakakarating sa kanila. In fact, I want to ask, what is the process when a barangay health center is asking for these medicines?
Usually, these meds are devolved function.
This is our problem, Mr. President, and I believe it is a policy issue. And His Honor has been here for a few years, so His Honor will recall that we have devolved many functions, and one devolved function is really health. And so the LGUs are in charge of procuring those medicines. But DOH has a stock that would be made available only in times of emergencies and calamities. So pagka kunyari may bagyo, tapos nangailangan kung saan man, sila yan. And then yung 5th and 6th class municipalities. Beyond that, it is the LGU. So I will add my observation here, Mr. President. This will never be resolved because I believe that a lot of the LGUs have difficulty in providing for the needs of this kind of maintenance needs. Kasi kung si PhilHealth nga, ngayon palang nag-uumpisa sa gamot package, precisely, I think that is born out of a recognition that the LGUs have never really been able, maybe a few, I know Taguig is very proud to hand deliver straight to the house of the patient itong mga maintenance medicines. Pero hindi naman nagagawa ng karamihan na LGU yon, no? So PhilHealth now has that gamot package. Yun ba yung worth 20,000? Tama ba?
Yes.
Worth 20,000 a year. But is that enough? I don't know. Kasi alam ko, thankfully wala pa ho akong maintenance medicine, so hindi ko alam ang presyo nito. Pero ang feeling ko lang, pag medyo nagpatong-patong ang iyong sakit, yung mga comorbidities, baka yung 20,000, a month pa yung gastos na yan, Mr. President. So, just to say that I hear the concern that His Honor is raising, and apparently yung nakastockpile na to is not the answer that we wanted to hear.
Okay,
Mr.
thank you for that answer, Madam Sponsor. So, ibig sabihin, DOH ay bumibili ng mga medicines na very important sa mga senior citizens na mga mahirap na kababayan by the billions of pesos every single year para ipa-expire lang sa mga bodega nila, Mr. President?
So actually, Mr. President, yung nasa bodega, naka-standby po yun para dun sa calamities. Kasi hindi nila mandate na ibigay yun sa mga LGU. By policy, it's the LGUs that are purchasing. Kaya nga sinasabi ko, Mr. President, we have a policy issue. Because hindi i-release talaga ng DOH iyon para sa mga LGU. Kaya nga po yung tanong ko, paano kung alam natin for a fact, as His Honor is saying, na kaya natin ibigay yung listahan sa barangay dito, sa bayan dito, ito yung mga nangangailangan. As of now, as we speak, LGU responsibility on Mr. President. So we are watching we are, in a way, helplessly watching
Madam
kasi
President, is
hindi i-release for that
Is
purpose.
that a legislation that you're talking about, or
Mr.
just a
President,
policy?
that is a
Policy?
that is
Is that
a
an
result of a Supreme Court decision, the Mandanas ruling, and for I think around 3 years,
Okay.
DBM has been working with the different agencies on how that will be implemented. This representation tried our best to ensure, I'd like to believe I had a hand in kahit papano yung 5th and 6th class municipality, tulungan nila kasi hindi talaga makakaahon yon, hindi nila kakayanin na bayaran yung mga gamot ng constituents nila. Pero if you ask me, kahit siguro yung 3rd class, baka hirap pa rin. Pero that is as far as we were able to do, Mr. President. So I think we really have to work on this because hindi talaga nila, maraming hindi nakaka-deliver, Mr. President.
So, Madam Sponsor, Mr. President, thank you. So I think we have to come up with a legislation to address that problem. Kasi kung hindi, Mr. President, every single year by the billions and billions of pesos worth na gamot ang pinapabulok lamang or expire sa mga bodega ng DOH, samantalang maraming mga senior citizens na kamatay na dahil hindi sila nakatikim o nakabili o nakakuha ng mga gamot necessary like the ones we mentioned, Mr. President.
Oh, actually, Mr. President, I already have a solution. In my interpellation with DOF and DBM, I pointed out that the government owes PhilHealth close to 1/3 of a trillion pesos. Ito po yung sin tax collection at yung collection na nanggagaling sa PCSO and PAGCOR. Pag yan dineliver nila, that is 300 billion, Mr. President. Pwede yan gamitin dito sa mga maintenance medicine. Yun na yung sagot eh. Kasi may program na natawag Gamot. Sa ngayon, 20,000 pesos lang. Pero they can compute. Pag na-deliver, kahit sabihin mong 1/3 of what is due na 300 billion, the 1/3, 100 billion. Pag yun nabigay, baka yung 20 million na, 20,000 na package, baka maging 40,000 na yon. Yun o yung sagot doon na immediate na nakikita ko. Kasi that money has been collected, Mr. President, from the sin tax, from cigarettes, from vapes, from alcoholic beverages, and from sugared beverages. And then PCSO and PAGCOR have remitted those amounts, Mr. President. That is with government already.
Thank you, Mr. President. So ano po yung plano ng, for the meantime, while we will be coming up with a legislation to address that problem, ano po yung nakikita ng DOH na mga policies o aksyon na gagawin nila nang sa gayon din na po masasayang every single year, like I said earlier, by the millions and by the billions ng mga medicines na nag-expire at mayroong policy nga nagsasabi for the meantime dahil na-devolve na at hindi pwedeng maibigay sa LGU. So ano po yung plano? Kasi po, billions ang pinag-usapan po natin, not only, hindi po change to eh. We're talking about billions of pesos of money wasted.
Meron po silang programa na purok palusugan kung saan na minomonitor nila yung compliance ng mga LGU dito sa devolved function nila, which is to provide the maintenance medicine. Tapos nakakapagbigay sila sa 5th and 6th municipalities, as I mentioned, Mr. President. Pero beyond that, it's really the monitoring and coordinating with the LGUs na they perform their responsibilities, Mr. President.
So maybe, Mr. President, the DOH has to come up with a study kung ilang calamities bang dumarating sa atin at ano yung mga areas na prone talaga sa mga calamities at gagawa sila ng mga calculations and then saka sila bibili ng mga medicines, hindi yung bili lang sila ng bili at sobra-sobra at hanggang sa nabubulok na lang po sa mga bodega and they're worth billions of pesos, Mr. President.
Yeah. Ang pinaka-solution talaga, Mr. President, is through PhilHealth.
PhilHealth.
Yeah, yung Gamot program, which has already been launched. But yun nga, may limit yan na 20,000
Okay.
for now.
Okay, thank you, Mr. President. Lastly, on that issue, sana, Mr. President, kasi masakit. In fact, I talked to several senior citizens nung malaman nila na nabubulok lang pala sa warehouse, samantalang kami, imbis na everyday yung maintenance namin, iniinom ko na lang once a week. Yung pala, meron palang mga gamot dyan sa DOH na nabubulok na lang. Kasi kung ipapaliwanag po natin yung explanation po ng DOH, Mr. President, sa mga senior citizen na nangangailangan po ng mga maintenance na nandun lang sa bodega ng DOH, they will not accept it. Magmumura po yun sila. Kung ano ng pagsasabi nila.
Well, ang kinaklarify lang, Mr. President, ng DOH ngayon is yung nabanggit kong example na Losartan, pati yung isa, mga near expiry, hindi pa ho expired. So
Kung na-expire,
I guess
dapat
ang sinasabi nila is hindi totoo na nakatenga yung mga expired drugs doon sa kanila. Oo, ang marami talagang naka ano pa is yung COVID medications. Pero katulad nitong Losartan, they only have literally 4,500 pieces na ano lang, maliit lang na bagay, maliit lang na amount pang ano nga, pag nagkaroon ng calamity. So, pagpalagay mo ng may 30 na pasyente na nandyan. Tapos yung near expiry nito is next year, hindi naman next month, no, next year.
So, yung Losartan mag-expire po next year. So, what happens kung wala pong calamity darating at walang mangailangan ng mga senior citizen regarding sa mga gamot na yan? So, matatapon na lang po, Mr. President.
Actually, with the number that they have on stock, 4,500, very confident sila na mauubos po ito kasi talagang, kumbaga, it's a certainty na daw na nagkakabagyo talaga sa atin. And yung 4,500 na stock nila is a very limited amount, Mr. President. Kasi nga, they do not stock for delivery to LGU. So, wala silang ganung kalaking volume, Mr. President.
Thank you, Madam Sponsor. That's a very good answer. And lastly, sana po, the DOH should come up with a program para medical mission at ipamigay na lang yung sa Losartans na yon kaysa naman mabubulok na lang. Near expiry na pala, so come up with a medical mission ng DOH. O meron naman kayo siguro mga mobile clinic. Set up a mobile clinic from different places and then mamigay kayo ng mga gamot na yon libre sa mga senior citizen. Bingo! Hindi, walang nasayang na pera. Kaysa naman nabubulok lang po sa bodega ng DOH, Mr. President.
Noted po, Mr. President, yun daw yung Purok Kalusugan program na nabanggit ko kanina at meron din naman daw po silang mga mobile clinic. Pero I know for a fact, Mr. President, kaya kasama yan sa mga individual amendment ko, meron din talagang kakulangan pa sa mobile clinic, nag-request ang DOH, so tayo po, meron tayong amendment na ganun kasi meron talagang lugar na hindi na talaga nararating nung LGU, so nagsistep up po doon ang DOH, Mr. President.
Thank you, Madam Sponsor, Mr. President. Now, let's move on. Itong Lifeline Rehabilitation Center, DOH accredited and privately owned. It's in Silang, Cavite. Inireklamo po sa akin to dahil yung mga bata na nandoon ay nakakapagpuslit ng alak, sigarilyo, at marami pa mga kabalastugan na nangyari. May mga sexual abuse pa na nangyari doon sa loob at we're talking about minors 13 to 16 years old. And we told the DOH about this and we were informed by the DOH na na-issue na ito ng cease and desist order after we let them know about the complaint. But we did call the Lifeline Rehabilitation Center. Sabi nila, we're open for service still. And we have a video to show, Mr. President. Can we show a video of that?
Para mapaayos yung anak namin, yung pala nilulugmok palalo doon. So ang goal ko po is malagay siya sa safe na lugar, humingi ng tulong sa professionals and facilities like that. And then, nitong huli, ko na lang nalaman na exposed pala yung residents sa mga ganong vices.
5 months po wala po kami electric fan doon. Sa floor lang po kami natutulog. Pag nag-complain kami say may surot yung bed, ang sasabihin lang namin ay kami ang tunay na surot dahil daw sa mga kasalanan namin. And then every day we would be reminded na mga adik kami, mga hudas, demonyo, malalande, yun yung mga tinatawag sa amin.
Other than yung nabanggit ko, ay meron ding na nangyayari. sa mga minors. Merong 13 years old and 16 years old na abused sexually.
Nakakalungkot naman po yung video na pinalabas nyo, Senator Tulfo. I'm checking now with DOH. Ang sabi nila is aware sila dito at na-issuehan daw ito ng cease and desist order. But
Correct. That's correct, Mr. President.
okay, and then, but sadly, Mr. President, this is an accredited facility. So, ibabalik ko ngayon dun kay Senate President, dalawa lang yung private na accredited. So, isa ba to sa dalawa lang nga lang yung accredited, nagkaganito pa yung isa?
Is that one of the accredited?
Well, I remember kasi they said dalawa lang yung accredited. Eh di,
Na
isa
private.
to, na private.
What is this one?
Lifeline Rehabilitation Center, Mr.
Is it
President.
accredited
It is accredited by the DOH.
by the
Mr. President.
DOH?
Privately owned. Licensed and accredited by
That's
the DOH.
horrible.
It is, and I was asking, Mr. President, how long is the validity of the accreditation? Because, syempre, ang gusto natin, yung maayos na accreditation, pero yung assured tayo na ma-maintain yung, yung quality.
3 years daw.
And it's 3 years. But, I was just listening to the very short video na sinasabihan sila na ganito kayo. Hindi naman ganun yata ang rehab. Hindi naman yata ganyan magpa-rehab. And sadly, I'll add to the discussion. I'm actually reading a book which I'm happy to share with all of you. About a scam so big in the United States na very similar na yung mga home for the aged at iba pang mga residential home, isa ang may-ari. Talagang pinagkakitaan lang. Like the service was horrible, the treatment for the residents was really bad. Hanggang sa na ganun din, na-investigate, tapos nakulong, tapos pinardon ni Trump. So apparently gimmick po to, and the book that I'm reading says that unfortunately itong mga hoodlums, mga mafia, they follow where there's a lot of money. So wherever there are government support, diyan sila pumapasok para I'm not saying I don't know. Wala naman yatang natatanggap na government support, pero pera ng pamilya yan, nakakaawa talaga. So, liwanagin ko, Mr. President, about the accreditation. Yung binasa ko kanina, and I remember now, I said, dalawa yung accredited ng PhilHealth. Kaya makakatanggap sila nung 10,000 na funding from PhilHealth. But for DOH, 62 are accredited. So, this is one of the 62. Pwede bang pabalikan natin? Wag na natin antayin na mag-request si Senator Tulfo. Pwede bang silipin natin lahat itong 62? Hindi naman siguro ganun kahirap na puntahan nito.
Thank you,
Para
Madam
siguraduhin
Sponsor.
natin na wala nang ibang makadanas ng ganito. Na nalukluk na nga sa drugs. Tapos baka ngayon nadagdagan pa ng mga mental health problems tong mga to aside from other addictions.
Kasi may response.
Pinapakita lang po sa akin ng staff ko if the senator or the other senators want to see. May response pa pala yung lifeline. No? Pero
They're coordinating, they go down
the usual, coordinating, investigating. Pero the fact na nangyari to, ibig sabihin, walang supervision, di ba? Dun sa staffing na nandun.
Correct. At walang monitoring din, Mr.
Yeah,
President.
baka iniwan lang yan baka nagpa-accredit, may doktor, may manager, tapos iniwan na lang sa
findings po.
May findings po tayo. Ang findings ng DOH ba to?
Yes po.
Ang findings ng DOH is that the center has an authorized bed capacity of 35, but they have admitted 68. The facility also house psychiatric patients together with drug dependents, which is not allowed. And there is not enough staff complement, no registered social worker, no full-time nurses. The minimum standard staff-patient ratio for psychologists or psychometrician, social worker, and nurse is supposed to be 1:25. Mataas na nga yun one health official to 25, and yet kulang pa sila. So, ibig sabihin dun sa 68, hindi sila nakadalawa? Ganon? Parang malala. And then yung manual of operations nila was not even present in the facility. It was in the custody daw of the owner. And the facility was found to be unkept with foul odor, and the living condition of the patient seemed to be unpleasant. So
Okay.
confirm po lahat ng sinabi.
See,
Mr. President.
who investigated and found that?
DOH investigated and issued the cease and desist order.
Do you have a team that monitors all these rehabilitation centers?
They do random checking. Ilan ang nagche-check?
Random
Kasi baka
checking.
pwede natin dagdagan yung PS, di ba?
Yes, not only that, perhaps what we can recommend is that you coordinate with the Dangerous Drugs Board and the Philippine Drug Enforcement Agency that a team monitor all the 52 rehabilitation centers accredited by the DOH. And as a matter of fact, all the other rehabilitation centers, as much as possible, they may be able to monitor them. That is the reason that during my time we closed down, I think, 3 rehabilitation centers because they were using a multidisciplinary system, which is not allowed, which should not be allowed. No? So, dapat yan, we should ask the DOH and the DDB.
Noted, Mr. President. We will
Thank
ask
you.
the DOH to also give us an update once they have discussed with Dangerous Drug Board and perhaps enter into, wag na natin pahabain, doesn't have to be, too technical, but the bottom line is we want you to coordinate with DDB to ensure regular visits and ocular inspections of these facilities.
Yes, and as much as possible, the only allowed systems should be the faith-based, the 12 steps Minnesota model, or perhaps eclectic, but never multidisciplinary system. I think you should be monitoring that. Ito ang klase ng sinasabi ni Senator Tulfo na nangyayari dyan sa Lifeline. Ibang klase yan. Ibang klase yan. Wala ako nakikita dyan dun sa mga system na tama na dapat sinusunod ng rehabilitation center.
Noted, Mr. President. We'll ask them to give us a report also on what is the system being adhered to by the different centers para nakikita din po natin. Thank you.
Thank you, Mr. President. So for the meantime, what is the plan of the DOH with this Lifeline Rehabilitation Center since they have flagged it with so many violations, tad-tad na tad-tad, ika nga ng mga violations. So nag-issue ng cease and desist order, pero tumawag po kami kanina, tumatanggap pa rin daw sila ng mga residente.
Yes, Mr.
Mga
President.
male patients.
Mr. President, as mentioned, there's a cease and desist order, so they have to stop. They have to. Wala na silang license to operate, Mr. President. So, Mr. President, they have already informed PIDEA, and it's PIDEA that will enforce the closure, and they will work with them on the rehoming, if I may call it that, of the patients here, Mr. President.
Thank you, Mr. President. So, may expect po natin, maybe next week, sarado na po ito, Mr. President, and the PIDEA will be the agency who will shut this down once and for all? Or involved din natin yung BPLO, Business Permit Licensing Office, sa lugar na yon para kasama yung PIDEA, para kadinahan yung pito na yon once and for all, kasama din PNP para kung magbatigas, magbukas ulit, kasuhan yung may-ari ng rehabilitation center, Mr. President.
The answer is yes, Mr. President. Kailangan mapasaran na ito. Pero they are waiting for PIDEA. So siguro while we are still in the budget period, we can in fact initiate. We can also call PIDEA and find out what's taking them. Mr. Senate President, a week ago na nila nasabihan si PIDEA, and they are awaiting the action of PIDEA.
Okay, thank you, Mr.
They'll
President.
be here tomorrow.
Perfect.
For their budget. I understand. It's their budget time tomorrow. We can find out Just for the record, you know, the number one and most ideal rehabilitation center here in the Philippines is the one being run by government, the Bikutan Rehabilitation Center. Last time I heard, it's still the best. It uses therapeutic community and faith-based system. So I think they should be followed by the other rehabilitation centers.
Yes, Mr. President. I think very familiar dyan si Senator Alan kasi binibisita niya lahat ng mga centers na yan pag birthday niya.
Okay.
Alan yung sa Bikutan na rehab center. Nabanggit ni Senate President that it is one of the best, and I said you're probably more familiar with it because you really visit.
Yeah. Mr.
Those
President, just to Senator Tulfo.
Senator Tulfo has the floor.
Yeah. With your permission, no?
Permission granted,
The staff there are really dedicated, and contrary to popular belief that the Duterte administration was all patayin nyo, hulihin yung mga yan, they spent money on it. But believe it or not, pati yung kalye lang doon na 5 million, 3 million, I'll use the word insertion, but it's actually an amendment. So hindi lahat ng insertion masama. But ang problema, Mr. President, ayaw namin umalis doon kasi convenient. But it's a model for other places, but I don't know why we never replicated it. And I think talagang kulang na kulang ang support nila. But if I'd really like to invite the two Senator Tulfos and our colleagues and SP, yung pag nakita nyo doon yung kasi pag tinignan nyo yung jail, magagalit kayo kasi punong-puno, kulang ng pagkain and everything. No? Yung Metro Manila Integrated Jail, Taguig City Jail, and yung high value doon sa Camp Bagong Diwa. But if you look at the facilities at how they make it work in the drug rehab, but Senator Tulfo, minsan kung talagang pwede kang pumunta, 10, 11-year-old na stunted na rin kasi 6, 7, 8 years old na sa kalye na, nagra-rugby na. So pag nakita mo, kala mo talaga 6, 7 pero 11 years old na. Meron talagang but if there's one thing that we can say na independently magaling, yung rehab na yun na nasa Bikutan. I think they have land na rin sa Tagaytay but I don't know.
Tagaytay is run by the NBI.
NBI.
Pero as I said, hindi Bikutan, when I became senator in 1992, we used to have the CDF, the Countrywide Development Fund, and most of my CDF were spent for the rehabilitation centers. Did you know that the Bikutan Rehabilitation Center in 1992, the food allowance is 17 pesos a day for each patient? I had to double, triple it so that they will be able to eat well. And as a matter of fact, there was a time that they were sending me the menu for the week to prove that they were using the money that I forwarded to them or used for them. So they're still the best, So congratulations, the Bikutan Rehab Center, and I think it should be the pattern of all the other rehabilitation centers.
Thank you, Mr. President.
Thank you, Mr. President. Two more questions. Siguro wala nang magsingit.
Huwag na natin payagan, Mr. President. Akong bahala.
Okay. In 2022 and 2024, I've raised the issues of bullying in hospitals. In ngayong budget hearing ng DOH, ay issue pa rin po ito, Mr. President. Marami pa rin nagreklamo sa akin dahil sila ay nabubuli o kaya may abuse of authority ang kanilang mga supervisor. Last year, I asked for a list of hospitals that recorded incidents of bullying, and I have not received any list yet. But I will transmit to the DOH list of complaints and complainants after my interpolation. So ako na po magbibigay. But for the meantime, ito po yung mga ospital na meron pong nangyaring talamak na bullying. National Children's Hospital, San Lazaro Hospital, National Center for Mental Health, DOH, Health Facilities and Service Regulatory Bureau. Andito po yung reklamo, andito po yung pangalan ng mga complainant, andito po yung pangalan ng mga inireklamo. And these are the actual complaints, and we will give it to you, Mr. President. And
Mr. President, our situation is this. According to DOH, they followed up on all the list of complaints that His Honor had received. But unfortunately, the complainants did not want to follow up. So I think we still can do more because syempre natatakot yun magsalita, di ba? Especially kung na-publicize yung kanilang complaint. Kasi the fact that natatakot sila mag-pursue doesn't mean it doesn't exist. That means they're scared.
That's the reason why I'm not mentioning their name today.
Yes, Mr.
tonight,
President.
Mr. President.
Yes.
And I'm giving it straight to the DOH for them to study it
Yes.
and verify the veracity of the complaint, Mr. President.
May administrative order na daw ang Secretary on anti-bullying sa mga hospitals. Pero I think what we have to do, if I may also recommend to the department, is a reorientation. Kasi sorry not to pero ang pagkakaalam ko kasi medyo may culture din na ganyan sa mga ospital minsan na seniority ng mga doktor, seniority ng kung sino man. Kung ako naririnig ko yon at hindi naman ako doktor, wala naman akong, well, may kamag-anak ko na doktor pero di naman ako naka-standby sa ospital. Alam natin yan na may ganon. So I think beyond an administrative order, you have to have a reorientation and change in the culture, Mr. President. Thank you.
Thank you. And last na po ito, Mr. President, leptospirosis cases surged to 117 in Cebu Province. The Cebu Provincial Health Office reported on Sunday that leptospirosis cases in the province have reached 117 as of November 20, with 106 confirmed cases and 7 deaths reported from November 1 to November 20 alone. Public and private hospitals in Cebu have been placed on high alert as they brace for a possible influx of patients exhibiting symptoms of leptospirosis. As of November 18, the Cebu provincial government has distributed over 10,000 prophylaxis capsules to affected communities. Taiputino was on November 4. Now, ang tanong po, paano po yung mga targeted and efficient distribution na ginagawa po ng DOH ng mga gamot at mobile clinics para ma-address po itong problema ng pagsisearch po ng leptospirosis cases sa Cebu Province?
So, Mr. President, the distribution of the drugs for leptospirosis is based on risk. So, for example, there have been 9,989, almost 10,000 cases reported from January to November 8. And the flood exposure accounted for 55% of those cases. Nationally, the epidemic threshold has been breached from September 21 to October 25. So, meaning to say, in that 1 month period, dumami talaga yung cases compared to last year. So 9 regions breached their epidemic threshold at least twice in the past 4 weeks. And so that in that case, dito ho sila nagfo-focus ng delivery of doxycycline for prophylaxis, and they also facilitate redistribution as needed, Mr. President.
That's all, Mr. President. Thank you very much, Madam Sponsor. Thank you.
Thank you.
Thank you. Majority Leader.
Yes, Mr. President, next to interpolate is from the minority, our colleague, Senator Joel Villanueva. I move that he be recognized.
Senator Joel Villanueva has recognized that the chairperson is okay. You would like a few minutes?
Naisip ko lang, Mr. President, kung si Alan magbe-break muna ako. Pero kung si Joel, kaya ko pa.
All right.
I take that as a compliment,
Villanueva.
Mr. President. Thank you, Mr.
Senator
President.
Joel Villanueva is recognized. And just for the record also, to addressing Senator Raffy Tulfo, forgive us for our trespasses.
Madami ho kasing nag-enjoy dun sa mga tanong ni Senator Raffy at mga example niya, Senator Raffy. That just means that yung mga nakita niyong mga issues, yung research niyo po, it resonated with a lot of our colleagues. Thank you also for your patience, sir.
All right. Senator Villanueva, you may proceed.
Thank you very much, Mr. President. Thank you to the Majority Leader.